Hi, how are you? I hope things are well. Thank you for joining me. My name is Michelle Moser, and I'm going to talk today a little bit about weight loss and low-dose naltrexone. Here are my disclaimers, of which I have none. So what exactly is low-dose naltrexone? Well, naltrexone as a drug was FDA approved in 1964 as an opiate receptor inhibitor. So really how it came about is morphine had been around for a while. They actually needed to prove how effective and how morphine actually works. So they developed this drug naltrexone to literally turn it off. In typical doses around 50 to 300 milligrams, we usually see that used for alcohol overuse syndrome or opiate overuse syndrome. But when we're talking about low doses, which we will be today, that it works similarly, but actually very differently. So we don't see as much liver issues. It still intermittently will block opiate receptors. It will reduce pro-inflammatory cytokines, and it also modulates the immune system. And to date, there's well over 900 scientific articles and case studies that have been published. It's a very well-studied medication. It is primarily compounded in very low doses in dosage forms such as capsules, tablets, transdermal gels, sublingual drops that can be flavored, as well as sublingual troches, topical creams, eye drops, and nasal sprays. But the bottom line is if we want any of this to work, we need to go with an oral route. So when we're dealing specifically with weight loss, it really is about a cycle. And what really happens? Well, people have habits, right? So there's a wide variety of foods that they eat. There's their comfort foods, the way they were brought up to cook, how to combine their foods, exactly what foods that they were most accustomed to eating. And that is across any culture, across the entire globe. So if we start restricting our calories, our body goes into kind of a holding pattern, and it will hang on to calories that it has because it feels like the body is starving and it's getting prepared for a Paleolithic situation where food just wasn't as plentiful. Well, that can also change a wide variety of metabolic areas, including hormone changes. So we have to be really careful with that. But the bottom line is that we need to really pay attention to calories and what those calories mean, as well as exercise to maintain a long-term lifestyle goal. Diets don't really fail. We do, right? So a diet may work, and as you're working on that diet, whatever medication or process that you're using, you're usually restricting your calories or changing your calorie load, maybe even changing the time of day that you're using those, and exercise. But once you stop that, we go back to our old habits. And that's what I mean by diets don't fail. We usually fail. Now, there's a wide variety of published studies that I want to bring up, and that's where you're going to see some of the numbers in the brackets. But naltrexone really helps to reduce insulin resistance. Anytime that we reduce insulin resistance issues, we're going to have less inflammation, but we're also going to have weight loss. But there's a lot more to that. Usually those individuals who already have insulin resistance, or also called metabolic syndrome, tend to be overweight, usually due to a thyroid disorder and or a hormonal disorder such as PCOS. But a wide variety of these metabolic issues can be contributory. In other words, they play on each other. And with that, they can kind of compound everything that's going on. And this is where naltrexone plays a very specific role. It also helps to modulate cellular resistance, decreasing that situation at the cellular wall. And that is much more prevalent in women than it is in men. It can also increase growth hormone. And why that's important is because it not only helps to build, but also maintain lean muscle mass. Also helps to increase fat burning. Both of those are going to help with weight loss. So that's fantastic. And it's very different with this medication than some of the other medications that are available out there. It also helps to decrease appetite. And we've heard about this ongoing for many years now. And even at very small doses, people are like, I'm just not that hungry. I just don't feel like eating as much. However, we have to be very careful because a lot of times when we restrict calories significantly, we can actually see a drop in active thyroid hormone, which means we can gain and maintain weight. In other words, your body isn't going to let go of the weight so that you can shed it. We also see that if calorie restriction is something done over a long time, that other changes in the metabolic system will happen. And that is a Paleolithic revision to modern time. Generally, prescription weight loss medications either go after appetite or metabolism. Rarely do they go after both areas. And LDN is actually one of those very few that seems to not only suppress the appetite, but also help to change the metabolism so that you can shed the weight a little bit faster. LDN reduces inflammation. Anytime we reduce inflammation, whether it's due to a chronic illness or even weight loss, we're going to see benefit. So all chronic medication, all chronic medical condition is based on inflammation, whether we're dealing with high blood pressure, even situations where there's a hormonal disorder, maybe Hashimoto thyroiditis, even when we're talking about cancer, it's all based in inflammation. So anytime a medication is going to help reduce cytokine production, reduce tumor growth, reduce the opiate growth factor receptor issues, then and also bind to the TLR, which is the toll-like receptor 4 and 9, we're going to see a reduction in inflammation. We're going to see a reduction in interleukin production, specifically interleukin 6 and 12, which are very pro-inflammatory. But inflammation can also decrease the conversion of levothyroxine to liothyronine. Liothyronine is the only active form of thyroid. So we have to be careful there. We also know that inflammation increases insulin resistance. It also decreases a wide variety of hormonal valuation, but it can also increase the metabolism of hormones to areas where we really don't like to see that. So estrogen is a growth hormone. It actually causes weight to stay on the body. And anytime that we see high elevation or high estrogen levels due to the conversion of testosterone to estrogen, we're going to see more weight staying on the body. Now, let's talk a little bit about sleep, because if you're not getting good sleep, if you're not getting good REM sleep, you're also not going to be able to maintain good body weight. Anytime sleep is disrupted, we see increase in weight gain, and that has everything to do with hormone changes such as cortisol changes and how cortisol will actually interact with those receptors, not just on the sex steroid hormones, but also interacting with how the body will release hormone. For example, cortisol goes up, then sugar comes out of the cells, gets ready to go into the bloodstream to be available for active movement, like running away, that sort of thing. But when we don't actually burn that up, then insulin has to come out of the pancreas, grab that sugar and try to put it back into the cell. And after a while, the body just gets really tired of doing that. And that's what's called insulin resistance. But we also know that low-dose naltrexone can actually improve sleep patterns. Now, people will complain that they might have sleep disruption because they're having vivid dreams. And that's usually because their chronic illnesses are keeping them from actually dropping into REM sleep. But when you have vivid dreams, that actually is showing us that low-dose naltrexone is working. So in a lot of situations, especially pain situations, which is very difficult to get good sleep with, such as chronic regional pain syndrome or just chronic pain anywhere in the body, naltrexone will help improve that as well. When we're looking at autoimmune diseases, so Hashimoto or Graves' disease or any type of thyroid disorder is usually what comes to mind, mainly because thyroid is the master metabolic gland. So low-dose naltrexone is often used to treat Hashimoto thyroiditis as well as Graves' disease. Most people are not just 100% one or the other. They're actually a mixture thereof. And that's because there tends to be kind of a roller coaster ride with a thyroid dysfunction. Low-dose naltrexone can help to reduce antibody production. It can also help change and improve the change of inactive levothyroxine to active liothyronine, and that happens at the cellular wall. So whenever we see that, we see a better metabolic process. We see the way the body will react and help to reduce inflammation, help to reduce autoimmune factors, but really work much more effectively and efficiently. Now, there's some commercial weight loss medications that are out there as well. Contrave is actually bupropion 90 milligram and naltrexone 8 milligram in a sustained release tablet. And this is the dosing regimen for that. But what we found is that when we use low-dose naltrexone, even jumping in at 8 milligram, let alone a long-acting tablet, that means that that tablet is going to be in the body 24/7. We don't see the same reactions at the cellular level, how low-dose immediate release will work. In other words, when you constantly have naltrexone at the receptor site and you're continually blocking pain, you don't necessarily see the reduction in the reduction in inflammation and the reduction of that cytokine production. So when naltrexone binds that receptor continually and constantly, it works very differently. And that's the same thing at higher doses. It works very, very differently. So many times people are not able to handle Contrave. Number one, it's very expensive, but number two, it's just a huge dose. And so we're able to compound much lower medication doses and slowly increase that so that people can do better over time. Now, phentermine is one of those medications that's been around for a very long time. And phentermine, it actually causes a loss of appetite. It also increases your feeling of being full or satiated. Usually we see about a 3 to 5%, maybe even 7% decrease in body weight over 3 to 6 months, which is a pretty typical weight loss scenario. But what we notice is that when you remove the medication, the appetite comes right back and you no longer feel full. And a lot of times we see that people are getting their weight back very quickly after stopping this medication. So these are areas to consider why use low-dose naltrexone for weight loss. So anytime a patient has an autoimmune disorder, reduce the inflammation, reduce the antibody load, you're going to see a reduction in inflammation, reduction in weight. So patients with hypothyroidism or Hashimoto's, Graves' disease, things like that. If someone has sleep disorders, if they've been diagnosed and even fitted for a CPAP or a BiPAP machine, low-dose naltrexone can be helpful. Chronic pain, as long as someone is not using a synthetic or an opiate type pain medication, we can use low-dose naltrexone. If someone is using opiate or synthetic opiate medications, then we have to be very, very careful because we don't want to send them into withdrawals. So there are ways to use ultra low dose naltrexone, help them get off of their opiate medications, then increase to low dose anywhere from 0.1 to 4.5 milligrams, and then carry on with the weight loss program as well. Low resting energy expenditure, and also ravenous appetites, because some people are really hungry all the time, but they don't have the same exercise routine. So there's a mismatch between the body saying, I need a lot of calories, and what the body's actually using. And therefore that extra calorie load causes weight to increase. And low-dose naltrexone can actually help with that. Also helps with hormone imbalances like insulin and leptin resistance. So I wanted to also cite a wide variety of references that I have used today during this conversation. And if you need any of these articles, let me know. They're available. and we can get those to you. There's 18 in all. This is how you can contact me. You can reach me through my email at mmoser@revcustomrx.com. This is my personal cell. You're welcome to use that as well. And I thank you very much today for joining me. And here's our network of pharmacies. We've actually added a couple more. So I hope you get the opportunity to chat with us at any time. And I'm more than happy to answer any questions that you may have. Thanks so much for joining me. We'll see you again next time.